ADHD. In ADHD, it affects attention regulation, impulse control, and in some cases, physical activity levels. The name is slightly misleading. It's not a deficit of attention so much as an inability to consistently direct it. People with ADHD can focus intensely on things that genuinely interest them, sometimes for hours. The difficulty is sustained focus on things that don't provide immediate stimulation. It also involves working memory challenges, emotional dysregulation, and a complicated relationship with time.
Schizophrenia. Schizophrenia is a serious and often misrepresented condition that affects how a person thinks, perceives, and relates to reality. The most recognized symptoms are psychotic, hallucinations, most commonly hearing voices, and delusions, which are fixed beliefs disconnected from shared reality. It also involves negative symptoms, flattening of emotion, reduced speech, and withdrawal from social life. The popular image of schizophrenia as violent is largely a media distortion. Most people living with it are more likely to be victims of harm than perpetrators.
Anxiety disorders. Anxiety disorders are the most common category of mental health conditions in the world, covering generalized anxiety, panic disorder, social anxiety, and specific phobias. They all share a core feature: fear or worry that is persistent, excessive, and disproportionate to the actual situation. What connects them is that the anxiety is not a reasonable response to what's actually happening, and it tends to reshape behavior over time in ways that make life progressively smaller.
Bipolar disorder. In bipolar disorder involves cycling between two very different emotional states. Periods of intense elevation, called mania or hypomania, and periods of deep depression. During a manic episode, a person might sleep very little, talk rapidly, make impulsive decisions, and feel invincible. Then the mood shifts, and the crash into depression can be severe. Both phases significantly affect relationships, work, and stability.
Borderline personality disorder. BPD is characterized by intense emotional experiences, unstable relationships, and a fragile or shifting sense of identity. Emotions arrive faster and hit harder than in most people, and take longer to settle. Relationships tend to swing between idealization and intense disappointment. There's often a profound fear of abandonment that drives behaviors that can push people away. Research increasingly points to early trauma and emotional invalidation as significant contributors, reframing much of what looks like difficult behavior as a survival response to an environment that was genuinely overwhelming.
Depression. And depression is probably the most misunderstood word in mental health, partly because it's used casually to describe ordinary sadness. Clinical depression is something different. It's a persistent low mood that lasts weeks or months, draining the person of energy, interest, and the ability to feel pleasure in things they used to enjoy. It affects sleep, appetite, concentration, and in serious cases, the will to keep living. It doesn't always look like crying in bed. Sometimes it looks like someone going through the motions of a normal life while feeling completely hollow inside.
Dissociative identity disorder. DID involves the presence of two or more distinct identity states that take control of the person's behavior, thoughts, and sense of self at different times. It's closely linked to severe, repeated trauma in childhood and is understood as a survival mechanism, the mind compartmentalizing overwhelming experience it can't integrate. People with DID are most often quietly managing fragmented internal experiences with considerable effort and are more likely to harm themselves than anyone else.
Narcissistic personality disorder. NPD involves a pervasive pattern of grandiosity, a deep need for admiration, and a limited capacity for empathy. On the surface, this can look like confidence. Underneath, many researchers point to a fragile self-esteem that requires constant external validation to stay stable. When that validation is withdrawn,
the response can be disproportionate. NPD affects relationships significantly, often in ways the person themselves may not fully perceive as problematic.
OCD. In OCD, it is built on two interlocking parts. The obsessions are intrusive, unwanted thoughts that produce intense anxiety. The compulsions are the rituals carried out in response: checking, counting, cleaning, repeating. The compulsion temporarily relieves the anxiety, which is exactly why it becomes a trap. The relief reinforces the loop, and OCD can consume hours of a person's day.
Panic disorder. Panic disorder involves recurrent, unexpected panic attacks, episodes of intense fear that peak within minutes and include racing heart, chest tightness, shortness of breath, and a sense of impending doom. The attacks aren't dangerous, but they feel catastrophically threatening, and many people end up in emergency rooms convinced they're having a heart attack. What sustains the disorder is the fear of having another attack, which begins to reshape behavior and can narrow the person's world significantly over time.